Welcome everyone to 22nd Annual Congress Pakistan Society of Hepatology 2022. I am Dr. Mohammad Nabil Shafkar, Postgraduate Training of Department of Gastroenterology, DHQ Hospital, Gujranwala. Today I am pleased to present frequency of portal vein thrombosis in patients with hepatocellular carcinoma presenting at DHQ Teaching Hospital, Gujranwala. Co-authors of our study are Dr. Najmul Seher, Dr. Ghania Shafkat, Dr. Nabil Aslam, Dr. Muhammad Adil Chaudhary and Dr. Muhammad Asad Aftab. We conducted this study because we know that hepatocellular carcinoma is the most common primary tumor of the liver and it is the third most common cause of cancer-related death worldwide. Portal vein thrombosis is characterized by the interruption of blood flow because of the blood clot formation, and this is considered one of the common complications of hepatocellular carcinoma, and it is not only a complication but also leads to a poor prognosis of patients with hepatocellular carcinoma. However, the prevalence of portal vein thrombosis is certainly underestimated, especially in our communities, being incidentally found in about 62% of autopsic livers. This study, which we conducted in DHQ Hospital Gujranwala, will give us the magnitude of frequency of portal vein thrombosis in patients with hepatocellular carcinoma in our community, which will further determine the burden of the disease in community and help decide to plan further management and reduce the damage caused by this complication in this subset of patients. The objectives of our study were to determine the frequency of portal vein thrombosis in patients with hepatocellular carcinoma presenting at DHQ Hospital, Gujranwala. It was a single-center, descriptive, observational cross-sectional study designed to determine the prevalence of portal vein thrombosis in patients with hepatocellular carcinoma. A total of 125 patients were selected from the Department of Gastroenterology in DHQ Hospital, and they all undergone a detailed history as well as a triphasic CT scan for the confirmation of hepatocellular carcinoma. A p-value of 0.05 was considered statistically significant, and our results showed that out of 125 patients, 72% were male, whereas only 28% were females. So the prevalence of hepatocellular carcinoma is higher in male gender. The mean age of presentation is 45 years, whereas the mean size of hepatocellular carcinoma in our study was around 4.03 centimeter. The main complication of portal vein thrombosis was found in around 29.6% of the patients, while in case of male to female gender ratio, 21.6% were male, whereas only 88% of patients were female. However, with regards to type and number of hepatocellular carcinoma, the portal vein thrombosis is more common in patients with naive HCC as well as in patients with multiple hepatocellular carcinoma. So in conclusion, we can say that portal vein thrombosis is common in male patients compared to the female patients with hepatocellular carcinoma. The prevalence of portal vein thrombosis is higher in naive hepatocellular carcinoma patients and with single hepatocellular carcinoma nodule. An early diagnosis of portal vein thrombosis along with the evaluation of the volume of portal vein thrombosis on CT scan will help decrease the burden as well as will lead to an early intervention is necessary. Following are the bibliography which were used to assess and to write down this study. Thank you everyone.